Good morning, everyone. And we don't have enough going on last year and this year. So, to hopefully a better 2021 versus 2022. But before I get started, I do want to talk about the life and legacy of Dr. Martin Luther King. He would have been 92 years old, and he was taken at too young of an age, at 39, away from us. And you look at his legacy. So I say to every kid out there, an adult, you can make a difference regardless of your age. I've seen kids inspire communities at the age of 9. I've seen kids do extraordinary things in adults. So don't let anyone tell you you can't do something differently. We saw a great story at Naples, Florida. Little kid, I think he was like 8, and saved a kid from his parents getting hit by a car. And these are things you can do. You can make a difference every day. And you know, when I think of Dr. Martin Luther King, you often wonder if he was still alive today, would he say our nation went far enough? Did we go backwards? Did we go forward 3 steps and take 9 steps back? And as he looks on what's going on in this country and how divided we are. And I have been very good for 10 months not to get into the political arena with anything. And, this is just about COVID. But I will just say this, I refer to Dr. Martin Luther King a lot during my State of the State, through speeches throughout the years, because he has inspired me as just a young kid growing up in the South End, and even as an adult, of the extraordinary things you can do. And he once said, and I'll quote him, "Darkness cannot drive out darkness. Only light can do that. Hate cannot drive out hate. Only love can do that." So we need to honor the legacy now more than ever. He spoke of unity, of love, of one another, to call out injustice and inequity in a peaceful way. In this country, more now than ever before, should be reading between all his speeches the fact that we're so divided. We need to stop pointing fingers. We need to stop arguing. We need to stop calling people out. When you have 150 million people vote one way or another, 74 million for one man and 78 million, give or take, for another man, we're still divided. And if we want to honor Dr. Martin Luther King today, please come together, put our differences aside, agree to disagree, and move on. Because we're never going to get through this, any election or anything, and COVID-19 and economy crisis and everything else going on, if we continue to argue and point people out for a variety of everything. It's crazy. I've never seen it. Talking about boycotting businesses, doing this, not talking to your neighbor, deleting people on Facebook, friends that were friends that are arguing. And I know COVID-19 probably has a lot to do with it and being shut down for 4 months. So please, as we honor Dr. Martin Luther King's short life at the age of 39, who obviously today's his birthday, he would have been 92, and he unfortunately was taken away from us on April 4th of 1968 by a madman. And we need to move forward and look at this legacy. And if anything today, just think of that. Think of his words. Think of how he inspired a nation, how he inspired the world without being violent, without looting, without doing anything crazy, being peaceful and getting your message out there. That's what we need today, unity. Unfortunately, today marks 312 days. We're in 44 weeks. And sadly, we lost 3 more residents last night. A man in his 60s, a man in his 80s, a woman in her 90s. Today brings our total to 275 since the outbreak started Saturday. But to the new families, my condolences and prayers and love go out to your families through these difficult times. And again, to anyone that lost anyone through these tough times. Again, it's hard enough to lose somebody. It's even harder in these last 10 months. So please take a moment to think of these families and all the 275 families. Announced Saturday, we found out of 7 additional deaths. In delay in reporting, 3 were from December, which really upped our numbers for the month of December of losing Albany County residents. It's frustrating. It's hard after 9. At that point, we're 9 months into it, to still have this problem with tracking, to still have these issues that we're having. We did so well. In the beginning, it was tough. Laid it out through the summer, fall hit. Things were still going well, and to now run into these issues again, it's it's tough, but real live data on a day-to-day base in a state this size of 19 million New Yorkers is tough. But New York's tough, and we got to be better at it because we owe it to the families, we owe it to everyone to put it out just how it is. As of today, there's 15,897 cases of COVID-19 to date. We have an increase of 172 positive cases since yesterday. That brings our 5-day average to a daily of 248.8. Yesterday it was 251.8, which is, our numbers going down. There are currently 2,990 people under mandatory quarantine. Yesterday it was 3,138, which is also good. Of the new positive cases, 38 had close contact with a positive case, 11 are healthcare workers, and 123 don't have a clear source of infection. 47,420 people have now completed quarantine. Of those, 13,995 were positive with COVID-19 and have recovered. Also great news. There's an increase of 312 recoveries since yesterday. And one of the things we've been looking at, did we hit the surge? And Dr. Whalen and I were talking about this today. Did we hit the surge? Are we starting to go back down? Because our positive numbers are going down, and the same number, roughly 3,000 people are getting tested every day. But one of the alarming things, and we pointed out, and the governor changed us from the matrix to hospitalization and IC beds capacity and all that, is our hospitalization. Alarmingly, 22 new people were hospitalized overnight. We're currently at 180 people hospitalized from this virus. Unfortunately, this is the highest we've ever been in the last 10 months or 44 weeks, whatever way you want to look at it, and it's alarming. Yesterday, the high was 169. The day before that was 167. There were 151 people hospitalized from the virus less than a week ago. Can't explain it. We have 16 patients currently in the ICU. Yesterday, it was 14. Our high of ICU was 24 back in the January 4th or 5th sometime this year. Don't hold me to the date, going off from memory, somewhere in that time frame. And, we look at bed capacity in the capital region. We're all in this together, and that was one of the reasons we did the partnership with Dr. Reed and St. Peter's partnership. And only time that new facility is going to be opened up, and we had to paint it, and there's new furniture in there, and it will be staffed by St. Peter's, and it will be separated if we run out of space. And I can assure you, as everyone's watching this or listening, that we hope that doesn't happen. But Saturday there was 8 people in the ICU, so that's something we need to continue to watch as we move forward. Our bed capacity right now is up to 25%. It was as low as 24%, so that's holding, and 19% still for the ICU beds were going up, and we went back down. That's something that Dr. Reed and his team look at every day, probably 2-3 times a day, to adjust whether or not where they're going with that. So please continue to wear your mask, socially distance, cough into your arm, clean your hands, and stay 6 feet apart. And we'll get through it. And we'll get through it if we continue to work together in a partnership. Aside from that, the following health guidelines, the only way it's going to be able to return to any sense of normalcy is the vaccine, plain and simple, getting the vaccine out to everybody. We all know that. We have the demand. We just do not have the supply right now. I get all that. We've got new guidance since Friday, and I have to tell you, I feel like I'm back in school. And it's just, the reading is incredible, dissecting it, and the game has changed again for us here in the county. So for all the counties in the state. So one of the things is that we worked through the weekend, how we're going to figure it out. We got 800 doses over the weekend, but one of the things I want to talk about is our county health department will be vaccinating essential workers, including now firefighters, teachers, college professors, grocery store workers, and more, and you can see the list. Pharmacies now in the county, pharmacies, will handle everyone, and this goes for across the state, but the guidance is a little confusing in Rensselaer County. I was talking to Steve McLaughlin last night, or yesterday. I talked to him a couple times yesterday, but we are not handling 65 or above anymore. That is no longer our mission. They switched scares on Friday night. We are only doing that group that we put in there, and you can, and I'll go to the dashboard after Peter, but the state does have who falls into that category. of high risk. And beginning January 11th, which already happened, state fire services includes firefighters, investigators, local fire services, police investigators, state police, including troopers, state parks police, DEC police force. Yes, we got state police in every cop in the state handled. Public authority police department, state fire investigators. I think the state workforce is pretty much taken care of. Public safety communications, our sworn and silver personnel, correctional officers, State Department of Corrections, local correction facilities are all eligible now that we have to deal with. State juvenile detention centers, pre-12 school district facilities or staff, contract workers in school districts, child care settings, grocery store workers, airline and airport employees now fall under this. Subway and mass transit, port authority, individuals living in a homeless shelter now fall under this, and people that volunteer in a homeless shelter now fall under this. And you can go for the extensive list of everything else. I don't want to bore everyone, but it's pretty intense that we'll be dealing with now going forward. So the appointments that we originally had with everyone over 75 and 65 last week and the 2 weeks before that, yes, you will get your second shot from us. Yes, we reschedule that day, which you're supposed to do. I know there's confusing at other sites, but anyone that walked through the Times Union Center got a date to get the second shot without have to registering, so which is good. Our partnership with Mohawk Ambulance will focus now on the 65. We spent the last 2 days now, the whole weekend pretty much, giving them our list of all the people we identified that are 65 and above. But most importantly, one of the groups that, and I continue to bring this up in the control room, and I will say this publicly, we need to address the homebound people, the people that cannot get out of their house, that can't leave, have different variety of issues, health underlying issues, that aren't on these lists. I don't know why they're not, but they should be, especially that we have everyone else on there. They should be in the 1B category. To all the local politicians that can continue to tell me when our shots are available or will we fall in that category, probably not to 1C. So, I mean, that's the guidance that are out. So one of the other things, we need to get the vaccine, check eligibility. You can call the state hotline number at 1-833-697-4829. So one of the things that I know all the issues with going online with people, calling, confusing for seniors, or they just don't have the savvy, and people in general, you go on there and I'm sorry, you almost need a master's degree to figure out the website and how you're going to get the vaccine and where you're going to go. I was talking to Steve McLaughlin yesterday about this. They had a couple in Rensselaer County that had to go to Utica on Friday to get the shot. It made no sense. If you got people going to Utica come to Albany, downstate New York coming to upstate, somebody should figure out in the system in the 21st century that you can say, hey, you're not going to go to Utica. The people come to Utica, they're going to take that spot. You're going to take this spot. And I know it's a lot, you know, and it's new, but this is what we deal with on the county level and stuff that we look for. So again, I will suggest to the State Department of Health that, and they're doing a great job. They're trying, they're struggling, and I thank them every day for what they're doing in the Department of Health. So I'm not calling you out, but to do a regional sign up just for that region that hubs in, it will make it simple, easy, and less confusing and less of a wait time from people. But that gets me to Pete Gannon, and one of the things when we spoke about the 211 is how can we help people walk them through it. Seniors get confused. It's simple. It's 3 numbers. You can call 211. Someone will answer it. Pete will talk about it. They'll talk about vaccine questions, eligibility, where to go, how to set up an appointment, 24/7, 365 days. So it will make a difference. And I can't thank the Greater Capital Region President and CEO Pete Gannon for being here to help us get through these difficult times for seniors. But Peter, I'm going to turn it over to you.
Thanks, County Executive McCoy. United Way, we were here the very first weekend back when nobody had masks and shoulder to shoulder up here talking about mobilizing everybody to help us get through this situation. I don't think at that time any of us thought we'd still be here 44 weeks later, yet here we are. But let me start by saying thank you to the folks on the front line. We have great partnerships with those traditional people you think of in those circumstances, like law enforcement officers, nurses, EMTs, etc. But we also enjoy relationships with the non-traditional heroes of this pandemic, like the ones the county executive mentioned, frontline grocery store workers who've kept us, our cupboards at home filled and allowed us to survive under really difficult times. So thanks to all of them, and thank you to you too, Dan, for your leadership. It's been remarkable, the amount of information we get from you. Been a tremendous help. United Way has really tried to maintain some agility throughout this crisis over the past 10 months to really just be able to be a resource wherever needed. That started with a partnership with the county executive almost a year ago on using 211 to report price gouging. We stepped in to help with taking emergency food requests for individuals under mandatory quarantine, not just here in Albany County, but throughout the capital region. And now, as we move to this next phase, we have information on the safety, the efficacy, and people's eligibility about the vaccine. There's so much information out there. There's so many different places people are being turned to. United Way remains sort of this, I think of us as Switzerland, as like this trusted source in a sea of information that you can get straight information. I know after our announcement last week that we would take some of these calls off the Department of Health hotline here in the county, there was some frustration from users who didn't get what they wanted. And what does everybody want right now? Everybody wants an appointment and a needle in their arm, and that's understandable. And that stuff will come as the volume catches up with the demand. But most of this information, I'll be very transparent about it. There's no magic trick to 211. A lot of this information folks can find online easily, whether it's on the county's website, capitalregionvax.org, the state's website, or even our 211 website, 211neny.org. So the phone line is reserved for individuals who don't have the savvy to get online, perhaps the access to get online, or especially with our elderly populations that really enjoy the security that talking to another individual on the other end of the phone provides. So like I said, there's no silver bullet by calling 211. There's no magic back channel to a vaccine, and as much as I wish we had that, it does not exist, but it's there to get information. We're seeing an increase in the public's acceptance and adherence to the safety of the vaccine. It wasn't always that way. So we see one of our big roles in United Way is to get information out to the public that the vaccine is safe, it is effective, and it's going to be to help us get back to some level of normal. So as I said, most of that information can be found online. If you do want to talk to a human being and you can't wait, we have some longer than normal queues right now on the phone line. You can actually leave your phone number, and when the call volume in the call center is lower, one of the operators will actually call you back. So be able to help you get that. In addition to the information about the vaccine, you can still report instances of price gouging. We provide that report to the county on a regular basis. You can still get patched through to emergency food, whether it's a meal or grocery style food information. General health questions about COVID, right? If you're experiencing symptoms or something like that, or just have some questions, whether it's you or a loved one, you can get that information there. And we're actually seeing the biggest increase besides vaccine. We're seeing information requests increase about tenant-landlord relationships. So a lot of concerns about housing, another moratorium, and we're not just seeing it from the tenant side, we're seeing it from the landlord side as well. Sort of boutique landlords who are really concerned about an emerging situation they have with a tenant who perhaps hasn't been paying their rent through the duration of the pandemic. So hopefully we're helping to alleviate some of the pressure in your Department of Health so that frees up those public servants to be making their calls about contact tracing or checking in on this high level of folks who are under quarantine. What I will say is going forward in the next week, another big thing we utilize 211 for is the scheduling of the virtual income tax assistance preparation. So another thing we do at United Way is we provide free in-person, it's going to look a little different this year obviously, but free in-person tax prep for individuals who make $57,000 or less. Why is that important, especially this year? There's been a lot of, again, a big sea of information. Am I eligible for stimulus? Did I get the stimulus? I'm not sure. The IRS trained volunteers this year will be equipped to help people take a look back, make sure they got the money that they were it's supposed to get from the federal government as a part of this process. So we are going to have 5 in-person sites. In-person is going to look a little different. You're not going to sit across the table from a volunteer this year, but you can drop your information, schedule sort of like televisits, and get your taxes prepared by an IRS trained professional. You get to keep those filing fees, and our free means free. There's a lot of people you'll see on TV over the next couple of weeks who talk about free tax prep, and then you get to the end and there's a $39 fee or a $79 fee. We want people, especially here in Albany County and the Capital Region, to keep more of their money, more of their earned money. And so thanks to our partners at ACAP, the Albany Public Library, Catholic Charities, Trinity Alliance, and SUNY, who are engaged in that effort. Starting on the 26th, you can call 211 to get an appointment for those income eligible individuals, again, $57,000 or less. You can also go to getyourrefund.com. It's a new partnership this year where folks can actually schedule their appointment online, or you can call any one of those sites I mentioned to make your appointment to drop off your materials in person and talk to an IRS trained volunteer. So that again starts January 26th. Also, for folks who are a little bit more comfortable online, United Way has launched the portal for myfreetaxes.com. That is a free partnership with TaxSlayer that allows individuals at a slightly higher income threshold, in the 60s, maybe even up to 70 this year. The final income threshold hasn't been determined. But you can go to myfreetaxes.com, fill out the information. They'll let you know when their site opens up. And again, that's completely free tax prep service. This is a great thing to bring more of our earned income back to residents here in the Capital Region to help stimulate this economy even further. So again, 211. One last note that I would say is, in addition to getting out reliable information to the community, another thing we see our role to be is to mobilize the people who want to step up and get involved in this response. This effort that you've undertaken, Dan, with your partners in the regional government here, it's the biggest endeavor we've ever had. Nothing even comes close to this effort to administer 2 million doses of this vaccine throughout the Capital Region. So that means it's all hands on deck. And that means it could be you out there watching today. How can I get involved and how can I participate? You can go to unitedtovolunteer.org. That's our local volunteer portal, which is just here in the Capital Region. And you can create a quick profile with your skills, especially if you're have some healthcare experience and would be eligible to be a vaccinator. That'd be helpful to know. That will direct you to Serve New York, which is a little different portal. But there's a number of other volunteer efforts going on right now, whether it's related to food or it's related to the actual vaccinations. Working with our children or our seniors who are stuck remote in are at home. UnitedToVolunteer.org is a great way to get engaged. I echo the county executive's sentiment about being inspired to a life of service by the life of Dr. King. And there's no better way to take action on that today than by getting engaged in your community. So if you want to do that through us, UnitedToVolunteer.org. But if it's not through us, do it through someone else and get off the sidelines and get in the game and help make a difference in your community. So thanks for having me, Dan.
Thank you, Peter. And before I go to the Smart Board, I did want to mention, one of the things when government works well together, Steve McLaughlin, I've talked to him too much this weekend. I think it was whatever it was, Thursday, Friday. He had a resident that her brother was dying, not going to make it, and needed to get a rapid test, and he couldn't get one. And we worked on it, and she got a rapid test, got to her destination, and spent the last 3 hours with her brother before he passed away. It doesn't always work that way, and it was great to work across the county to make something happen for somebody to see their loved one. Also hearing from a lot of restaurants too, the gouging prices that they're putting on napkins and other stuff in their restaurants. We are going to look at that. I hear your message loud and clear, the owner, and I don't want to say who it is. We're going to see if they're gouging you for this type of stuff and make sure it's not happening. Spectrum, I heard they were saying they put a $5 surcharge on their bill a month. I don't know if that's true or not. I got to look into it, but we're going to look into it. We still are looking at this stuff to make sure that this isn't going down and people aren't being gouged through this tough times, because working together we'll get through it. But I do want to go to the board behind me, the smart and talk about the state COVID vaccine tracker. It's one of the things that we brought up in the control room, and I do want to say, whoa, what happened there again? Where do we go? That's why I got up, Peter, while you were talking. I just wanted to make sure it didn't, there we go. It's one of the things that I want to say Mayor Sheen and the rest of us on the control room kept talking about. How can we track the vaccine? Where's it going? How's it getting out in the area? And it shows like Albany County, you can do this at the state. And Capital Region received 78,550 doses so far. 53,789 got out with a 68% rate. Friday, because the new doses came out yesterday, Friday we're at 93% for the amount of doses, and we were up there with the southern tier and the northern tier that actually have 81% and 83%, but it breaks it down, every region, and it breaks it down over here. First dose, 553,000. First dose administered, second doses, and then it goes on from there, but it breaks it down even further. The weekly doses, each week the doses arrived, how many. And it's what the Governor Cuomo has said and has advocated for, and Dr. Zucker, we need doses. We have the demand, we just don't have the supply. And when you're looking at numbers like this across the state of New York, it makes it difficult, because you have to be fair how you get it out. And then roughly it gives the guidelines for federally long-term care facility. There's roughly I think 611 nursing homes in New York State and how they got vaccinated and how many doses went there. So it breaks it down. It has the guidelines. What does the vaccine data come from? How often is the data updated? Within 24 hours. Because we were at 93. Looked at the board before we came down here. I'm like, how did we drop down to 68%? It added in the doses that this county's received, that we'll be receiving, so it brought our numbers down. And then again, it just breaks it down, and then you can go frequently asked questions and stuff like that. That will bring you to a whole nother site. And will the vaccine, give me COVID, or COVID vaccine safe for children, and they say phase 3 clinical studies, 12 years and above. So it can break it down, and like I said to people in the beginning, you have to educate yourself. You have to get out there, spend some time researching it, and you can get your answers. This is the vaccine list that we received yesterday. Breaks all the doses down, where they're going, what pharmacy's getting it, who's not getting it. I'm not going to say who in the county is getting the vaccine besides us, because they're probably going to need time to come up with a plan. They probably have a plan to put it in place, but there's a couple more pharmacies that were added to the list in Albany County that will have the vaccine to hand out. And again, please, everyone be patient. It switched gears. We got 800 doses. Dr. Will and her team will break it down. It's nothing new to us. I do want to say to the Department of Health, Dr. Zucker, they're doing a great job. It's been extraordinary 44 weeks for us here in the county, or in the Capital District. For them, it's been tougher. And let me tell you, the man's very impressive. Has a JD. I think he has like 4 master's degrees or 3 master's degrees. Very educated gentleman. And again, to all the people that work for the Department of Health, they're doing an extraordinary job under these tough times. And you know what? My heart and prayer goes out to all them and to everyone that's out there every day doing the thing. And Peter said it right. So again, educate yourself. It's only been 44 weeks. We'll get through it, working together, not finger pointing. Remember, it's a marathon, not a sprint. And if you look at it that way, it's going to be this way, at least this way I said before. I hope I was wrong. I was hoping the Times Union or the Altamont Enterprise or the Record was going to say, or the Gazette, County Executive was wrong. And, we weren't. We've been looking at this data for too long, following the science behind it and educating ourselves, Dr. Whalen and myself. And we knew. I said September, until we get more vaccine. President-elect Biden said that he's going to use the Enhanced Government Act, or WAR Act, to make mass productions. Until that gets out, till that starts happening, it's going to be a while. It's going to be a while until we get more vaccines enough. So I do want to say, please go out and get tested. Do the right thing. Continue to do the right thing. Our partnership with Whitney Young, 518-465-4771. We cover the cost. Please, Albany, if you need to get a test, it's free, 1-888-364-3065. And again, you can go to albanycounty.com. And to our mental health support is available 7 days a week from 8 a.m. to 518-269-6634. Our 24-hour sexual assault hotline number is always, I can't say our 211 now to answer your questions to help these seniors through it. Peter, again, thank you to you and your organization for always being there, just not for Albany County, but for all of the capital region and everything that you do day in, day out. If anyone just reflects on today and Dr. Martin Luther King's birthday, please leave the politics aside. Let's heal as a nation. Let's move forward, and let's work for the people. And that's all that matters at the end of the day. Please be safe out there.